working with two actually gentlemen. We're working with Michael Martin, who this establishment is in, and also J.C. Seneca. These are two individuals that love their community. What we're able to do together has been pretty powerful.
Today we're here in a collaboration with my foundation and G Health, the Native American Community Services, and Seneca Health, and providing a vaccine pop-up for COVID-19 so we can vaccinate our community.
In this case, the Native American population, which is small in percentage overall, but there's historically reasons why we're small, even going back to the smallpox outbreak that we didn't have a defense for, and we wanted to make sure that COVID didn't have that same detrimental effect to our community.
Mainly we are trying to get the Native American community to come in and get these vaccinations. We have had talks with them, and we don't want them to be afraid.
Native and Hispanic people have higher hospitalizations than the non-Indian or non-minority community or the white community. Literally 3 to 4 times higher hospitalizations, literally 1 to 2 times higher death rates. So, you know, we have to vaccinate those that are, one, most vulnerable and those that are at risk. And it just so happens that it is the American Indian and Hispanic populations that are at highest risk for this disease.
And so partnering with the state, with our health providers and Dr. Vasquez at G Health, and even members of the Seneca Nation to promote this to our community, so that we really, in my mind, we're saving lives. You know, the potential for COVID and its devastating effects not only to an individual but to the family. We're just trying to change the course of potentially history in terms of making sure that our people live to their fullest potential. And it's been a hard work and labor, but it's been a labor of love because we're doing it for our community, for our families, and our future generations.
What we're trying to do is bring awareness, especially in the Native community, that we have about 135,000 cases and a certain percentage of deaths which are high. I don't think the Native community really got access to the testing on time, and we've only vaccinated 500,000 Natives in this country, and that's sad. So what we're trying to do is have an impact on that to make sure that we don't forget. We're all one people.
The Native American community has suffered great losses from COVID-19.
It's affecting every age group now. You know, we have a baby out on the Seneca territory that's sick now.
It's really important that everybody realizes that this is a good vaccine, a good choice for everybody to protect themselves and their family members.
The statistics show that they're the least amount of people in the minority group that are getting vaccinated. So we're trying to use our community outreach in order to do that.
Today we're doing a pop-up clinic at NACS, and the Native American Community Center. It was well known to me growing up, and I'm happy to be back here today doing the pop-up clinic and getting Native Americans vaccinated, as well as other underserved people and older people and anyone who has chronic conditions at this point.
When I found out about the vaccine, that they were going to be offering the vaccine, it just made me very excited because I had the opportunity as an Indigenous member to participate.
Yeah, I think in many communities of color, there's always some inherent hesitancy around trusting, you know, the old saying, you know, government, I'm here to help, but it hasn't always been helpful to a lot of our BIPOC communities, and so there's always sort of a skeptical thing, you know, where there's some people who feel there's things that are being done intentionally to our populations, and there are others that maybe don't trust the science.
Some of them are skeptical, but many of them, because they trust us, have signed up to come in, and many of them have, and they've talked to their family members, and we've gotten a lot of them to come in.
There's a lot of myths going around about the vaccine, but I want you to know it's very, very safe and it's very, very effective. There have been absolutely no deaths of people who have gotten the vaccine, while COVID-19, as we all know, is very, very dangerous.
At first we were on the wall about getting it, and then we thought, well, eventually everybody's going to have to get vaccinated, so might as well get it now you know, in the early stages of this instead of waiting.
I would say that, you know, I thought I would meet more resistance. I meet more resistance every year for a flu shot, but people are really scared, and I think the seriousness of everything is bringing people together, which is great.
You see that the virus, the people that have suffered from it, their families gather around them, and no matter what issues they had, they throw that aside and they love them, and they're just so thankful that they're still here. So I really feel that this message of love and forgiveness is a big part of this.
So the vaccine is not a live vaccine. There's no chance that you'll get coronavirus from the vaccine. You may mount an immune response, which is a good sign because that means your immune system is working for you. It kind of mimics a part of coronavirus that is a protein. So what happens is your body's tricked into kind of thinking that it's combating coronavirus, and then it starts to build the antibodies.
So that if you do in the future come in contact and are exposed to the COVID virus, your body will recognize that spike and be able to mount an immune response and protect you against the virus.
So the most common thing is a site reaction or pain in the arm because, you know, you've just had a needle injected into your deltoid muscle. That's not surprising. If you have any allergy in the skin, that's also common. What we've been finding is that Tylenol works really well if you do feel under the weather. Like I said, you are mounting an immune response, so you can feel a little feverish, slightly sick, tired, but usually it's just your immune system kind of using that energy to fight off any infection that is like coronavirus in the body so that you can build those antibodies and become immunized. So we monitor you for first 15 minutes because that's a CDC recommendation for any kind of allergy to the shot itself. There have been no deaths from the vaccine, and it's a 1 in a million chance. Like Dr. Fox is reminding us, he's educating everybody as they wait the 15 minutes, what to expect later, and also why they're waiting. So after you get your immunization, you go to our waiting area, and you just wait for 15 minutes where you're monitored by our medical director, which is really important.
Today I came to get the vaccine for the COVID.
Yeah, I just got my shot just minutes ago, and I'm just in the waiting area now to make sure I'm not experiencing any symptoms after the shot.
I got my shot today, just a little while ago.
I just went in, sat down, they took my blood pressure and my pulse just to make sure my vitals were okay.
The process of waiting and actually sitting down and getting the shot was probably the easiest shot process I've ever been through.
It was fast and easy, and the nurse was great. I didn't even feel the needle going in.
Overall, it's pretty simple, pretty painless.
It was kind of sore, and then after it healed, a couple days, it was okay. It wasn't too bad.
I did notice that both of us were napping a lot, and we're not nappers.
I don't like needles, so it was kind of a little for me when I got the shot. But after that, it was fine. It didn't have any reactions. It was sore where the needle went in. That's about it.
It was quick, fast. It didn't hurt, and they were very professional about the whole thing.
I feel great. I haven't had any reactions. I haven't had any side effects. No fever, no anything, and just feeling great. No sore arm or anything, so it's good. And actually, Dr. V is very good at this. He actually is able to administer it so your arm isn't sore. So that's a great thing.
To me, it just felt like a typical inoculation, a regular vaccine that you get. It's the same process. They swab your arm, take your vitals, swab your arm, and give you a shot.
I feel fine. I mean, I wouldn't know I had a shot.
I think when you get your ears pierced, it hurts more.
I can feel where it was at, but I wouldn't even call it pain. No ill effects at this point, and doing all the research and literature, feeling very comfortable, and just even weighing the pros and cons as I talk to other people. The risk of getting COVID and dying because of our high rates of comorbidities in our Native community, unfortunately, whether it's diabetes, blood pressure, obesity, asthma. We have high rates of cancer too. That put us at a greater risk of dying if contracting COVID versus the small side effects we may get, and that's just may get by getting the vaccine. Certainly the benefits far outweigh any risk, and that's why we've been promoting it and trying to get more of our community involved and engaged to get the vaccine.
I would just say it was painless and have no side effects, so if you could get it so we could get rid of this COVID and get back to normal.
If something's going to happen to me, I prefer to have had the shot than not have the shot. And if it can help us try to eradicate this situation, this disease, then why not get the shot?
Getting the shot is a good thing. I think we have to really send a message out into our Native community because I know there is some apprehension in some circles that don't want to get the vaccine, but I think it's something that we need to do, that people need to do their own research and make a good decision in regards to what they think is best to protect themselves, their family, the community, and our nation. Those are the 4 things I think that are important that people need to think about.
I want to encourage you to consider getting the shot because, for one, this is the most criticized, the most watched intervention in the history of the world, right? So if anyone gets sick, if there's anyone with an adverse effect, everybody is going to know. And then plus we have resources, like we have the mobile unit over there, and we have physicians in there that can take care of you if there's any kind of adverse effect.
As a youth, as a young adult, I think we should really consider our elders in our community more.
It's dangerous right now to think about getting elders together because just having one positive person could potentially kill a whole set of our elders. But at the same time, they're in dire need of the breaking that social isolation so that they can get together and be with each other. That's what they want the most. And or even to have time with their grandchildren or other loved ones.
Our elders in the community carry our history, our oral history, and they have a lot of stories that they tell that we haven't heard or that our young people need to know to carry on our history because it's not always written. So they need to make sure that they're well so they can share with their grandkids, the community, to teach them about our culture and our history so they have the better view rather than a European view on our history and our traditions. So that's one of the reasons I would emphasize for our elders, please come in and get your shots so we don't let our culture die.
You know, our Native elders are such a precious resource. They're the ones that really pretty much speak the language in many of our customs and traditions.
We're going to have to be the ones that teach everybody to help the 7 generations.
You know, getting vaccinated is really to protect them, you know, because we need them here. They need to pass on the customs and traditions, and we have to make sure that they live and they're living well.
So the vaccine itself not only saves their life, but allows them to deal with those mental health issues of loneliness and isolation. And on the flip side, with youth too, you know, if we can mitigate risk into the community, the faster we can get to having youth, whether they're in school or in after-school programs, where they can get together too and break some of those issues. We know suicides in young people are increasing over the stress of the pandemic and that social isolation. And by more people getting the vaccine, we're going to have a quicker pathway to getting back to that normalcy and also dealing with those other health issues that the pandemic's caused beyond the virus itself.
So that we can engage as a community, so that we can come together as Native and Hispanic people, so that we can practice our social customs and traditions without having to be worried about infecting somebody with a virus that could potentially, you know, cause death, you know, or cause the end of their life.
So you have 2 buckets that you can fall into. There are almost 28 million cases of COVID and 490,000 people that have died from COVID. And we vaccinated 59 million people and no deaths. So you got to decide which bucket you want to be on. The other side of it is we have a lot of post-COVID syndrome, a lot of things that are affecting people after COVID if you make it through. So it's really important that the vaccine are actually preventing people from dying, which means they're not going to intensive care units, they're not being intubated, and everyone, whether you're Native, Latino, African American, has had someone touch in their family with COVID.
Because we never had this before in the world.
And too many people are dying that did not need to die from this virus.
It's really important to me to protect myself and also to protect the people that I work with.
For me, well, it's more to keep my family more secure about me working and being in the public.
Part of it's my health conditions, but a lot of it's more or less to keep my family safe.
I want to continue to be able to help people, and I can't help people when I'm down.
As long as our family's healthy and happy, I'm happy.
so I can be around my grandchildren, my great-grandchildren. I haven't seen them in a year, and I want to hug them. Now I want to see family I haven't seen.
I like to think about my community, the elders, and how high at risk we are. Just thinking about culturally and historically how the Native community, the indigenous community of the Americas has been affected by diseases.
I have to make sure that I can be healthy for my children and make sure that I'm here without succumbing to this illness.
For me, I know like it was something that I wanted to do to help myself, help my community, help people in my area. And I think that if everybody could do that, then we would be able to get rid of COVID-19 a lot faster.
Or at least have people where they are prone to not spread it all over so that we can try to get back to some normalcy. Talk to each other, to travel, to do things that we normally used to do. We still should social distance, we still should wear masks, but hopefully we're less likely to spread it to each other.
For me, to protect myself, to protect my patients, and especially because I come from, an underserved area and in the midst of a lot of people that don't really trust healthcare as it stands today, it's really important to get the correct information out there so that people know that they can trust this vaccine, they can trust their providers at Urban Family Practice to make sure that we get everybody immunized, especially in the communities where immunization rates are low and health literacy is low, but we're here and we're a part of the community, so we're really working. We love to do this work to get everybody immunized.
I guess I would just strongly suggest people to be a little bit more proactive in how we can combat this pandemic. The more people that wear masks, the more time you wash your hands, the more you stay socially distant, the numbers will start to go down. And people are longing to return to what we had a year ago, and that was really large gatherings and people going everywhere and feeling free to do what you want to do, to visit, to hang out. We'll get back there, but people do have to be diligent.
We're seeing evidence that in the couple weeks following the second dose, people are at a reduced rate of infection and transmission, and we're hoping that the numbers continue and the data continue to show that.
Just talking to healthcare professionals and seeing listening to their advice and how the vaccine is going to help me and help my people in my community to try to get rid of this, it made the decision a lot easier to be like, okay, yes, I definitely want this.
I think it's better for everyone. That way it makes us all safe.
Do a little bit of research, talk to your doctor, talk to some other people who have gotten the vaccine, see what their experiences are. There are some side effects, obviously, but they're usually very mild, and they definitely pale in comparison to anything that you might experience if you contracted COVID-19.
It was, I was feeling very thankful to have the opportunity to be vaccinated, and it didn't hurt at all, and it was very quick, and so everything went very well.
So I want to encourage everybody to please get vaccinated, because it is really our only defense right now in the pandemic is the vaccination, because honestly, we didn't do such a good job in surveillance and doing testing and contact tracing. So we're stuck with this intervention method. I think we all need to use it, and I think we all need to get involved.
Through the work of working together and trying to educate people and eliminating some of those things that are considered falsehoods and myths or mistruths or misunderstandings to ease people in their understanding. People have to come to it on their own terms, but again, the benefits outweigh the risk and the identified risk that we see today. And
I don't think there's anything you need to be worried about. The research shows that having a reaction to the vaccine is slim. You're more likely to be struck by lightning than you are to have a reaction. Do your best to stay informed.
We're encouraging people to get it to save their lives, but also, all of our people are attached to a family, and a loss in a family is devastating. But when we're a small percent of the population, a loss in our community is magnified even more.
So it's critically important that we take efforts and strategies just to target specific populations and specific communities, and this is one of those efforts.
I think it's important to think about the New York State rollout of vaccines and to really think about the Black and brown community the most because we are disproportionately the most affected by COVID, the most hard-hit communities.
Let's protect our people the best way we can, and by getting vaccinated, that's how we can do that.